Beauty Boosters, it's DNP Anisa, and today I want to show you my essentials of all the treatment rooms in my medical spa. I did one of these videos about a year and a half ago in my other office and it did so well, but I want to show you a couple updates that I made, so come on in. Starting with on my counter space, I wanted a really pretty monitor that was not black. I wanted it white and really sleek that matched the aesthetics of my treatment rooms. So I found this one on Amazon, and everything that I'm going to show you in my treatment rooms will be linked in my Amazon. If it's not on Amazon, it's most likely on my because it's truly a medical supply. But I wanted a monitor to show off the before and afters and a couple injection videos that we showcase on social media so our patients can see what they're getting and also ask for about questions of other services we offer that they didn't know about. I also wanted to make sure I had a clock on my counter to keep my eye on the time because we have a very busy schedule here at Beauty Boost and time is of the essence. I do have a Wi-Fi password. We do not have the best Wi-Fi connection in our building, so it's important that all of our patients stay connected. We do ask them to post a selfie before they leave so that way we can showcase them on our stories. I have Purell for obvious reasons. Before I touch faces, I always want to make sure I pump and gel up my hands for disinfection. And then a menu of all of our memberships. If you want to see more about our memberships, definitely check out my Patreon. I go through all the memberships and why I chose certain services and the costs associated with it if you want to learn more for your own medical spa. I have a handheld mirror. Unfortunately, this is no longer on Amazon. Please help us this out. I need to replace this one. I got this sign custom made on Etsy with Aspire and Ally links for patients to have not only same day savings for Flash, but also if they want to sign up for future savings. Over here on the left, we do have mints and chocolates for patients. Mints because people sometimes get embarrassed that they have coffee breath or they just think that I can smell their breath, which is never the case. I feel like every woman loves chocolate, or at worst, if they feel a little lightheaded with injections, this just helps spike their blood sugar. I have this cute little heart dish for if they have jewelry on and I need to go near their ears or neck, they could just simply place it here and then grab it on their way out where they typically store their belongings here on this cute little accent chair. I have a little fluff pillow because I really feel like that adds a lot of cute, glamorous character to the room. And then I got this big round mirror for a reveal. I want them to see that overall result of their treatment. Here I have a needle drop area with a biohazard sticker so people know that this is not a normal trash chute. This one is. There is a nice pull out to replace both of them, but this is locked for safety. Here on the first pull out drawer, I have different size gloves for different injectors. I am always a medium and my injectors are always a small, so whoever is using it, they have their glove size. Some 4x4s to just take off the numbing cream, dental bibs for the tray, and I will show you my tray setup in just a minute, makeup wipes, and personalized logo terry cloth headbands. Next drawer, this is where all the fun is because I really thought this whole entire drawer out. This is what I most commonly grab that I want available to me at all times. Starting from the right, I have tongue depressors. These really help me when applying a numbing cream, putting it on the patient's face, and even taking it off. When I wipe it off with a 4x4 before using a tongue depressor to remove all the excess, it becomes less cumbersome. It's just a nice clean sweep off. I also have cotton tip applicators because I like to point to patients' faces when I'm doing a consultation, and then also it helps roll out PRF underneath the tear trough when I am doing that procedure, or nose filler. I like to kind of roll out the filler just to help mold it. I also have masks, pink ones of course, so when I am doing lips and I'm getting really close to their face, I am protecting myself and the patient. I have extra needles if I do need to change them out and I didn't bring extra ones in from the back office. These are at my disposal in different sizes. Usually it's a 27s and 30s in here, which I typically use for injecting filler. Hair ties and even these cute little hair clips. Some people have bangs where you just need to move it out of the way for their before photo or the treatment. I got these off of Shein. I have a pencil sharpener that I used to use for my white pens, but I've decided to just kind of move on to the roll-up ones, so I might take these out later. I have these little containers for arnica gel. I like to send patients home with it, or the post-injection elastin serum. If you know, you know. This is magic stuff with arnica, bromelain, and everything you could think of to help heal a bruise quicker. I definitely highly recommend checking that out. If I have time, I do label it with a cute little sticker. Here I have little squeezies or stress balls, and then paper tape if we are coming in doing PRF just to tape off their arm from bleeding, but we have switched to cute little pink band-aids for that. I have alcohol swabs, even though I do use a hypochlorous acid pump, which I'll show you in a minute. This is just a nice little quick swab if I need to. I have prednisone tablets, 20 milligrams. I like to give this for people who who get either lip filler or more than 2 areas injected on their face, but not for PRF and sculpture because you do not want any type of a steroid when doing those procedures. I have a little post-it note if I want to write down something important about the patient or write them down some information that I wanted to relate to them with a personalized pen that we got made off of Vistaprint. I have tons of Upneek samples. We are obsessed with Upneek in our practice. It is the first and only eye drop that is used for making your eyes not only whiter, but even larger. This was originally made for medical use, so I'm really happy they brought it into the aesthetics. My little pen drawer, I'm gonna bring it out so I can show you everything. I have 2 vibrational devices, which are so fun and cute, and patients get excited to use these during their treatments. This is also linked on Amazon. I have my markers and my pens that I like to use when marking up the face, and then finally my pens for making little notes. Also, you notice here, I do have free tablets that are not in the blister packs in a bottle here. These are just more cost effective, so once we are out of the blister packs, I'm just going to be putting them in little Medi cups for patients to take. I also got this a while ago, but I'm not crazy about it. It's antimicrobial hydrogel by Purison. It's just a cleaner topical to put on than arnica if you're worried about secondary infections, but I've never had one in my practice, so I don't really reach for that often. This is the arnica gel that I've used since day 1 in my practice for applying after Botox injections, filler, I mean, you name it. I put this on and it just takes away redness and relieves a little bit of that inflammation and swelling. I have Back Bar Skin Image, which is what I put on patients' lips after their lip treatments, and they usually buy at checkout. It's like one of my favorite lip balms along with the goat's butter. It's not in here. I should definitely make one for my treatment rooms, but that is my new obsession for lip topical after injections. I also have Elastin HA Immerse Serum that I put on if I want their skin to look and feel a little more hydrated. It's also a great selling point for checkout for an amazing HA. In here, I have aftercare instructions. We are actually going to go away with this because we are linking it to our checkout portal where they will get this automatically emailed to them. But this is something we had a little workaround until we got that configured on our EMR called Boulevard. I love Boulevard, you guys. If you're thinking about EMRs, check out Boulevard. I've tried everything under the sun. Aesthetic Record for a year and a half, hated it. My Aesthetics Pro, very outdated for the first 2 years of my business. Vagario, great, but didn't have all the functionalities for a medical spa. We did have to do a lot of setting up, which is normal for every EMR, but this QR code links to our Dropbox, and that way they can do a little screenshot and save it for their post-care. I have a Sculptra booklet that I like to just kind of bring out and show the patients before and after, so they know that they don't get that unnatural look if they don't want to go the filler route. They could just learn more about it. I always end up giving them a brochure to take home and do some reading. That way they feel that they are well informed when they come back for the procedure. I have my very beloved Faceify wand. We got this custom made by the owner, Crystal Coral. She now sells them only all in black. Sorry to break it to you guys. This is a massaging device that was originally created for lymphatic drainage massage, push the fluid out of your face, but I use it for post-Sculptra massage. We know that with Sculptra, you have to be massaging the area continuously to avoid nodules. It also has a heating mechanism to it. It heats up, and this patch heats up for eye if you have puffiness. And then finally, there's a little scrubber, so definitely check out Faceify. I forgot there's a vibrator to it. We also got this custom made off of Etsy. It is so bling. I actually thought this was gonna be a little bigger in person, so when I got it, it's kind of sad. It's not a big visual for our patients, but really cute for social media, you know, pictures. And then I have a handheld fan. Some people get really hot during their treatment, so this just helps them cool down or when they're nervous. And then if I do a VI chemical peel, sometimes it's really stinky. This really helps fan and aerate the room. And here I have eye protection. I usually use this when I'm injecting any blood plasma to protect my eyes. And then here I just use for storage. This is just Upneek that couldn't fit in my back office. I usually restock that area once it becomes depleted. And on this side, we have a cute fuzzy blanket. This is from Target.com, and a cute little neck pillow. I loved this idea, but my employees thought this kind of looks ugly, which now I agree. It's like a bone-shaped pillow you put on the back of the head, and this is from Amazon. Personally, I have neck problems when I lean my head back, so this just provides a little cervical comfort, but I don't reach for it as much as I would have liked to because it's stuffed behind here. The bottom one doesn't have anything yet. We did just move in about 8 months ago, so I'm sure all this will be filled up soon. We do have our scents that we carry here. I love the scent that we customize here at Beauty Boost. We work with the makers that create the iconic scent at the Wynn in Las Vegas. The one that we got custom made for Beauty Boost is called White Tea and Fig, and it just reminds you of beauty boast. That's all I can say. So I really wanted something long lasting for our patients to remember us by. Ah, it smells so good. Up here, not very exciting, but we do have post-care instructions when we were giving out paper copies. As you notice, we moved on to the QR code, but these were ordered from Vistaprint. This is not used as much as I wanted to, but it's like our little comfort boost that if they're waiting, they can get what's called Sip, Snuggle, Smooth, and Sharpen. Their choice of a beverage or a little fuzzy blanket or red light therapy or Upneek. So just kind of helps buy the time if we're running late. More Upneek samples if we need to replenish our stock, and they could read a little information on it while they are waiting for it to kick in about 5 to 15 minutes. I have toner here because I do like to wipe lips as a disinfectant during my lip injections. Alcohol and hypochlorous tends to dry out the skin, so this is a little more hydrating, astringent, and tissues because some of these injections can be tear jerkers, or some people just trigger a sneeze, and I always want to make sure I have this on hand. Coming over here, still storage space of our disinfection wipes, alcohol wipes, gloves, dental bibs, pink masks, tongue depressors, gauze, and then cotton swabs, so nothing exciting here. But over here we have our vascular occlusion and blindness protocol, so we are ready to go if God forbid we get into that event. I did make that myself. If you want access to it, check out Patreon, it is linked there. And then my daily checklist for my medical assistant to restock the room of everything that I went over should be in the drawers. And then last but not least, this is my stand. I love that we got in the champagne color that matches the hardware of my cabinetry. It just is more cohesive. Got that off Amazon. And then I know this looks kind of weird, but I have a mason jar full of gloves. It's just because I constantly have to keep coming back and forth, opening the glove drawer, grabbing some more gloves, and just kind of was unsanitary to me, whereas you just pick up a glove when you need a replacement if you touch something on the chair, and it's just easier. And then a little tray of gauze, that way I'm just set to keep taking and grabbing as I go. A pen, and then this alcohol pump, which is actually filled with hypochlorous acid spray. Last but not least, I want to show you this doorbell. It's conveniently hidden on the side, but if I need something from my medical assistant, I just push this. It triggers her. She comes in and asks what I need, and then I just let her know. So that way I'm not like, hold on, opening the door with dirty gloves and asking and kind of yelling out the hall. I feel like that kind of looks and feels unprofessional. If you enjoyed this video, please let me know and what you want to see next.